Hello everyone, I hope you're all well. Welcome to today's Meet the Expert session. My name is Amy and I work for the My World of Work Live team within Skills Development Scotland. It's our job to help you understand about future careers in Scotland and what skills are going to be needed for those job roles. So today I'm very excited that we have an expert from Public Health Scotland. Today we have Garth Reed and he will be talking to us just shortly. But first of all, we're going to talk about some labour market information. So once we go over this, we will then introduce you to our expert and then we'll take any questions. So I'd encourage you to get as involved as possible by using the Q&A box to the right of your screen. You do not have to participate if you do not want to. You can ask questions anonymously. This session will be recorded for any young people that couldn't make it today, and it will be available on the My World of Work YouTube channel. So you can go back and rewatch and check that out whenever you like. So without further ado, let's jump into finding a bit more about the healthcare sector. So the healthcare industry is the largest in Scotland. Over 400,000 people work in this industry as of last year. So that accounts for up to 15% of all Scottish employment. However, there were over 5,000 vacancies in healthcare in 2019. So the future of healthcare, because of these vacancies, looks like we're going to need these to fill these skills gaps, because 24% of those vacancies are due to skills shortages. And this is because the future of healthcare is becoming so digitalised. From 2019 to 2029, they estimate that almost 80,000 jobs are going to be required to replace the demand of an ageing workforce. So looking into that future, the top 5 occupations are going to be carers, nurses, therapists, medical practitioners and public health professionals like our expert today. So our expert today is Garth Reed. He is a public health intelligence principal. And his career started out by studying genetics, which is my degree as well. He then went on to study a master's in public health and has worked in a wide spectrum of areas in public health, from cigarettes and alcohol to policy, and he even lectures. So that was a brief synopsis, and now we're going to hear from Garth, who's going to talk us through his career journey, where he started and where he is now. So on to Garth.
Thanks, Amy. Thanks for inviting me along to talk to you today. I thought it would be useful, you've heard my kind of bio there, but I thought it'd be useful to just talk a bit about how it all began for me. So I grew up in a rural part of northern Malawi, which is in Southeast Africa. And it was a really sort of I grew up in quite a it was quite a poor part of the country. There was a lot of dirt roads and intermittent electricity. There was real poverty in the local community, and most people were subsistence farmers. And I was out there, and my dad had gone out to work in one of the hospitals there. So when I came back to Scotland, I went to school, obviously. In Malawi, I was homeschooled, actually, which a lot of you will have been doing. And when I went to secondary school, I loved lots of things about school, but I really liked biology, particularly genetics, which Amy and I both weirdly did then as a degree. So I worked really hard and ended up getting enough grades to go do genetics, and really enjoyed that. But I wanted to have a job that was more involved with people. And I also wanted to go back and work in developing countries, probably partly because of my childhood and what I'd experienced. So I looked to see what jobs I could do at that point, finishing my undergrad degree. And I'd have loved to go and work for the WHO or one of the big international agencies. And I realized that I really didn't have the experience and some of the skills that I needed to get into something like the WHO, and it was really difficult to do that. And that's where I stumbled upon public health, and I realized that with public health I'd be able to go and work abroad and to really get experience of working in the field. And I viewed that as a sort of stepping stone to working with the WHO, which I should have said is the World Health Organization. So I ended up managing to get a master's degree program, and I found that on international public health. And I did my thesis on delayed presentation in leprosy patients in Malawi. So I went back to Malawi to do my thesis, which was really amazing to do that. And then after I finished my master's degree, I got a job working as a researcher in Ghana for 5 years on maternal mortality, which is also a really amazing experience. Ghana is a really fantastic country, and I met some really wonderful people facing some really big challenges and some real poverty as well in Ghana, and similar to as was my childhood in Malawi. I really, after 5 years, really wanted to come back to Scotland and sort of questioned what I was doing in Ghana. And I realised that a lot of the poverty that I saw in developing countries is an issue which we face in Scotland as well. And so I came back to Scotland and I got a job working for the NHS. And I worked for NHS Lothian on a teenage pregnancy project, really trying to work with young people and to try and reduce teenage pregnancy in Lothian, which is a great experience and my first experience of working in the NHS. And I really liked it, and there were so many other people who cared so deeply about what they're doing, and you see that a lot in the news now. There's a really strong narrative about the NHS, which maybe there wasn't before the pandemic. After I finished in NHS Lothian, I got a job in what was Health Scotland, in the evaluation team there. And as Amy said, I worked on a whole range of different things, on tobacco and alcohol, on e-cigarettes. I worked on the minimum price evaluation, which you might have heard of, you might not. And then now we've had the creation of Public Health Scotland, and I'm currently heading up a research hub for Public Health Scotland, looking at COVID-19, and we're really trying to bring academics and the academic community and research community closer to operational work in the NHS so that it has its biggest impact, because the research that is done in Scotland and internationally is so important for us to manage this virus. So that's really how I came to work in public health. There wasn't a master plan to start off with, I think, but I always followed what I wanted to do, I think, and what I felt I was good at, and I worked hard to get the grades that I did to try and achieve those goals. And yeah, now working on COVID-19's, it feels like a really important thing, I think, to be doing, and I think that it shows the value of public health, which maybe people didn't appreciate before. And obviously there's much more to public health than just infectious diseases, but they're a really key part.
Perfect, thank you, Garth. I totally agree with you that public health is now getting the recognition that it deserves. So we'll start off with a few questions. I'm going to start off with your current job, and then we might work our way backwards to Malawi because that sounds very interesting. So what is the current day-to-day for you like, and what was it like before COVID?
So the work's changed quite radically in terms of what we were focusing on before. So a lot of the work was probably longer term. So we were looking at addressing smoking and alcohol. So thinking about policy actions which would have probably a longer term impact. So things which would take a long time to bring in or take a long time to have an impact. Whereas now I think working on COVID-19, both the pressure and the timescales are absolutely changed. So the information that we need to turn around is much quicker. And there's a real desire for evidence and to have evidence-based policy and evidence-based action, which is absolutely excellent. But it's really challenging when we're the people who are part of the groups of people who are providing some of that evidence. So providing information on quarantine following international travel, or things about contact tracing, and also obviously vaccination now is a huge program, the biggest public health program I think that we've ever had in the country, probably in every country as well. So yeah, the scale of what's being done and the pace of it has really changed hugely. And we're all also working from home, just like people are studying from home.
Yeah, the changes has been monumental in the last year or so. So touching on something you mentioned about in your bio, so you were talking about how you didn't have enough experience or the right skills to go straight into an organisation like WHO. So what kind of skills are required for your role? What's the most important skills that you use?
I think it's probably not in the job description, but I think the caring about what you do, so the passion that you have for your work, and the thing I always think is that at school you're marked on your grades, whereas when you're at work, actually, you know, your passion is really important. Being prepared to, you know, it's a bit of a trite phrase, but to go the extra mile. You know that when we're under these huge pressures to produce information in time, people will have to work longer hours in order to get information that needs to be used to decide, are we going to lock down schools? Are we not going to lock down schools? You know, so people are working incredibly hard in the whole of the NHS, from public health as well, and in the government. It's a really collaborative approach. So I think that there's the technical skills, but also there's something about attitudes, and you don't see that in a job description so much, or I'm not sure if it's talked about so much at school, but you know, you never get graded on passion in school, and actually it's a huge thing at work. And then I think in terms of technical skills, so quantitative skills are really important, but also things like qualitative skills, and having leadership skills as well. So those softer skills, being good with people, being able to listen, being able to learn, being able to be flexible, and to be humble, and to be able to find out information from people, no matter who they are. And I think that we're really trying to make sure that we're working closely with the public, and that I think that people's belief in what we're doing and belief in the messages are so key. And this will only work if we do it together as a country, for example, with vaccination. So vaccination will only work if we all get vaccinated. So there's no point having a vaccine which people won't take. So, and I think the narrative around that's been excellent. And I see, and you know, really people wanting the vaccine and wanting it quicker, which is fantastic. And I'm the same. You know, I can't wait to get vaccinated too.
Excellent, some really good messages there. And actually, my favourite quote from all of the expert sessions is that you don't get marked on your passion. I think that's a really important message, that you follow what you enjoy and what you're passionate about. I think that is a great message. So we have another question coming through. So speaking with that narrative and that public awareness, so I assume that you do agree that the pandemic has made the general public more aware of public health, and how has this helped or hindered your sort of job role?
I think it changed my job so dramatically that I have a completely different job. I think it shows you, from my point of view, there's, you know, these questions around society and communities, and I think some of the things that the pandemic has actually done is brought some of our communities actually closer together, and that people actually you know, have responded to what they've been asked to do, and they have stayed at home even though it's been really difficult. And of course, not everyone will do it, and there will be people who don't go and who contravene the guidance and won't follow the guidance. But actually, the vast majority of people are doing that, and it is so important. But I think that actually, I wonder when we look back on this in the future, whether it's something where we see that the country actually pulled together, and I certainly feel that. And as someone who works in the NHS, having people talking about the NHS and how much it means to them, it makes me emotional. It makes me sort of so proud of our country and of the NHS as well, and for it to get that recognition, as opposed to focus on waiting times not being met or things like that. I think that there's a real appreciation of it, and I appreciate it never before.
Yeah, I totally agree. So I guess that's one positive that's came from COVID. So following on from that, do you think more young people will want to therefore get jobs in public health? And if so, what subjects would you recommend that they take?
I hope so. I think it's a great job. I think it's an important job, and we need more people. So I would hope that people would have found it interesting, and it is very interesting to be doing as well. But you do feel very humble doing this work as well, because it feels like there's a lot riding on it as well, and I think people really appreciate that. In terms of skills, I think that public health is a really broad discipline, if I could put it like that. And so there isn't a one size fits all. So I think, I would encourage people to consider it really regardless of what your skills maybe are, but in terms of whether you think that it's something that you are interested in and that there's something you could do. So if you're really into numbers and you're great at analysis, you could come and work in public health. If you're actually great with people and want to do networking and sessions and outreach and community work, that is that you'd be well placed in public health too. If you're into literacy, and communications and social media, there's all sorts of work for you in public health, and these things aren't mutually exclusive. You can be great with numbers and great with people, obviously, but I think that people could consider it as a really great route in, and that there's a lot of different things which you can do, and I've demonstrated that in my own career. By mistake, I think, probably not intentionally. I've worked abroad, and I've worked on a whole range of different topics, from maternal mortality to e-cigarettes and COVID-19. So from my point of view, I love that breadth, and that I love doing different things, and I don't want to just spend my whole career doing one thing. So yeah, I'd encourage people to be open-minded and to look at it and to think what they could bring to public health and the future. And as you say, I think we have so much to learn from the younger generation coming through, and modernising our work. So, for example, we're looking at how we can use artificial intelligence around literature searches, and to see how we can use technology to automatically gather information from websites, published research into a single place, to have a one-stop shop for COVID-19 research in Scotland. So we're doing that at the moment. So yeah, I'd encourage people to look at it, and it's very broad, and there's no single type of person or single pathway to it.
Yeah, absolutely. So I know COVID is so topical at the moment, but I'm going to leave that there for a second, just because I'm purely interested in when you were working abroad in Malawi. So one question I'd like to know is, was there a difference in the sort of public health system in Malawi from when you were growing up to when you went back as, a postgrad when you were doing your research? Did you notice a difference?
Yes, so Malawi went through a huge transformation between when I was growing up and small to then when I went back. So when I was small, there was dirt roads and intermittent electricity in where we were. And actually, when I was there, they were building a tarmac road up through the country, which seems astonishing now. We take it for granted. We take our infrastructure for granted. I think you don't in these countries when road and transport's really poor, and I think they had a similar transformation in terms of their health service. So, for example, if you've got dirt roads or paths, and then it can be the phrase is it's too far to walk. So, for example, when a woman goes into labour, if it's too far for her to walk to the health centre, then she'll deliver at home. Now, a lot of the times that'll be fine, but actually, if you need help, and some women will, then you need to be able to access healthcare. So although a lot of improvements have been made, there's still a real issue around access. But I suppose during my from my childhood to when I went back in my 20s, I saw a real change of the infrastructure and the scale of the health service and what could be provided to people. And we are so lucky to have the health service we have in the UK. And you really see that when you go to other countries and you hear stories of people deaths just because of a lack of access, and we've got our own issues in Scotland with rurality, so if you're living in one of the Western Isles or in remoter parts of Scotland, then it can be difficult. But we've got things like telehealth, so technology can really help. But sometimes actually you really need to get taken into hospital quickly. And we've got helicopters and, all of these things which cost a lot of money, but they save a lot of lives.
Yeah, I think we should definitely appreciate our NHS and our public health services more, just based on that alone. So I'm sure Malawi was a big factor into you pursuing a career in healthcare, but what or who were the other influences? What inspired you to undertake this career?
I think a lot of it probably was my childhood. I think at school I wasn't so sure initially what I wanted to do, but I wanted to do something that I suppose made a difference, and I felt that I didn't quite know what that was though. I think at that point I had a sort of idea of eventually working for the World Health Organization or something like that, but through that I've ended up coming to the NHS instead. But I had some great teachers, a great biology teacher, and also a great geography teacher, and I think that the teaching is such a key profession, and I think although there's been a lot of attention on the NHS, I don't think that teachers and teaching has actually probably got the recognition it deserves. And they're still doing, we've got teachers in school teaching kids at the moment, despite lockdown, all of the work they're doing with all of the online work as well. So, maybe although the NHS has probably had a spotlight shone on it, I think probably teaching and teachers probably need a bit of that too. So I don't think there was a single individual for me. I think it was a culmination of what I wanted to do, and I think I wanted to sort of make a difference with the job that I did every day, and probably a bit of my background as well.
Yeah, well, I have no doubts that you would have inspired some young people today. It's been great to have you. Another interesting question has came through. So, is there an area of public health you'd like to work on that you've not had the chance to yet?
That's a good question. I sort of dotted around quite a lot of different places. I think the thing which I really want to do is to see the evidence that we have to be used as much as possible, and also to look at what research we do next. So what I see is, great policy people in the government, and I see great academics, and I want to sort of bring them together so that we have these great research ideas that then are being really applied. And you're seeing that now in universities, and we're very lucky in Scotland to have some fantastic people. So Professor Linda Bald, who is on TV quite a lot, doing an amazing job talking about public health and explaining things. And she's an academic who really is having a huge impact on policy and practice. So I think it's sort of bringing those things together would be the thing I'd like to see, probably not specifically I don't have a single topic which I'm trying to pick off. I think it's doing that. And the reason I sort of care so much about that is I think that if we can do more and more of that, we'll be able to make better and better policy and have better practice, and we'll be able to save more people's lives ultimately.
Yeah, and obviously that is the goal, that is the drive, I'm assuming, that you have, is to save lives, as with all of our other NHS professionals. So if one of our young people wanted to get into this area of work, what might help them or give them an advantage to have on their CV, thinking about extracurriculars or anything like that? What's your opinion on that?
I think extracurriculars are really important as well, and I think that shows that kind of passion, the drive to do the work as well. I think also when you do volunteering, I think it really it gives you a bit of an insight into other people's lives and how other people are. So I volunteered and worked in a care home, or volunteered at a care home, and it was just something which I'll always remember, and making, friends with these elderly people, some of whom are, got some really serious health conditions. And sometimes that can be quite shocking, but also you sort of appreciate others a bit more and the lives that other people live. So I think that kind of volunteering is really important. And in some ways, maybe doing some jobs as well, that sometimes summer jobs can be useful because you appreciate what other people do. I worked as a cleaner in a hospital, and I have since then had so much respect for people who do cleaning jobs, and I know how tough it is, and I know that it is not appreciated like it should be. And I think then if you then go on to do a different job, it gives you a bit of understanding and a bit of appreciation of that. So sometimes doing something completely different can be good as well. But I think it's worth considering a lot of different things and not sort of worrying about, do you have to do a specific thing? I think that it's about controlling what you can control, focusing on the things you're interested in, and trying to work hard at that, trying not to worry about what grades you get, because again, in my experience, the grades you necessarily get at school once you go in to work aren't something which would then be discussed hugely. It's about working together as a team to achieve something. It's not, well, that person got an A and that person got a B. That stuff's really not relevant, but it is relevant for getting into the workplace. But I'd more would encourage people to focus on what they care about, and really, I suppose, working hard on what they do love doing, and not worrying about the grades necessarily, and hoping that will come, and that if you really want to do it, you will find a way of doing it. And I suppose my career in some ways reflects that there wasn't a single path, and it wasn't a case of I went to university, did a single degree course, and then went into a single job, which I've done since then. I moved around quite a lot and had to find my own way a little bit, but that was okay.
Yeah, that's also a good message, that not to look for anything specific, that whatever you choose to do, whatever you're passionate about, whether it be volunteering or a part-time job, you can apply what you've learned in any of those roles to any career. You'll have the same skills. You can transfer all of that over. So thank you for noticing that, Garth. So we're getting on to the last few questions. So I'm going to ask you a double-decker. So what is your favourite part of your job, and what is the most challenging part of your job?
My favourite part of the job, it's probably working with the team that we've got. We've got an incredible group of people, and I just really appreciate them and their skills, what they do, how much they care about their job, how expert they are. There's some really inspiring people that I work with that I find inspiring, so yeah, I think that's the best thing would be that, but also seeing the work which you've done, used and useful is really rewarding, I think, as well, from my point of view. The most challenging part of the job, I think, is probably we're under a lot of pressure. There's a huge amount of work to be done. It's really serious. We need to do it really well. We understand that. We appreciate that. We're working really hard on it. So, you know, people are working really hard, and hopefully the vaccine will come and there'll be some respite for some people as well. But I think that probably that pressure and that pace of work is probably the biggest challenge, I'd say.
Yes, I am not envious at all of that challenge that you're all facing at the minute. So you spoke about your projects from teenage pregnancy and alcohol. So is there one that you can pinpoint what's been, you know, the one you're most proud of, or what one was your favourite to work on?
Oh, it's difficult to pick a favourite one. One of the bits of work that I did, which may be of interest, I suppose, was I led the development of a sort of consensus statement on e-cigarettes, so position statement on e-cigarettes for Scotland, and worked with a whole bunch of colleagues with that, and some real experts who guided us on that piece of work. And it was a really difficult bit of work. It's a very divisive issue, it still is. Off the back of that, I was asked to go to Hong Kong to sort of roundtable discussion chaired by the WHO, actually, for the people I've always wanted to work for, but never quite got there, I suppose, that looking at e-cigarettes sort of internationally. And that was fascinating. And it was in Hong Kong. It was looking at, thinking about what Hong Kong should do on e-cigarettes. And there was a whole series of speakers from all around the globe back in the days when that kind of thing still happened. And I suppose it opened my eyes to different perspectives on a single topic and this international arena working on it. But it was great to see Scotland, the work that we'd done in Scotland getting recognised, and that they were interested to see what we had done in Scotland. And I think that we often forget, I think Scots are very humble, which is a good thing. I think we actually also do a really good job in a lot of the work that we do, in all sorts of different ways, not just public health and health, but in all sorts of different areas. And it was just really nice to see that and to see Scotland getting that recognition. And I think that Scotland does some fantastic things, and there's some fantastic leaders and researchers and professionals in Scotland across the board. And so it was really good to see the work that we were doing had been picked up, and that people wanted to see what we'd done in order to think about what they would do in their country. And I think that's a really excellent thing for Scotland.
Yeah, Scotland has definitely done its fair share for the world of health and healthcare. I'm sure everyone knows about penicillin and things like that. So another question as we start to round up is, I know it must be impossible to think of a world without COVID or a world post-COVID, but thinking into the future, what do you think the focus of public health will be like, and what do you think will change after COVID?
Yeah, that's a difficult question. I think that, what we've been through is going to be a lens through which probably our generation or generations almost, see the world, I think. So in terms of a post-COVID world, I think it'll still have echoes for a long time, and I think we'll be looking at what the longer term impacts of it are. So, for example, things to do with respiratory issues from it. But in terms of non-COVID work, I think that really a lot of the focus will need to be on poverty and looking at what we would call the determinants of health, the causes of of poverty, and I think that public health will really need to focus on them. So some of the issues around, things like housing, also things like the environment. So I think that there's some really big challenges ahead, and actually climate change and the environment are public health issues. When the environment goes wrong, it becomes a public health problem because people start getting sick from ingesting whatever it is that's happened, whether it's pesticides or whether it be small plastic particles. So I think that public health will have a huge lot to do in its hands, but I think some of the key issues of the day will be there, and I think poverty and climate change, I think, would be two which would be absolutely central to what needs to be done.
Excellent. And thanks for pointing out, I never made the link between climate change and public health. Maybe that's silly of me. Hopefully I'm not the only one, but that's very interesting to learn, so thank you. So with the last couple of minutes we have left with the Q&A session, Garth, is there anything you'd like to say today to our young people, or any last bits of advice you'd like to give to anyone thinking about pursuing a career in healthcare?
No, thank you for the opportunity to come to talk to you. I really appreciate it. And I think that, really public health and healthcare need the next generation of people to come and work with us, so that then we can continue doing the work that we're doing and to learn from, I think, the next generations. And I think that there's so much which we can learn, probably particularly about things like technology, and I think a lot of the future will need to be focused on that, regardless of which bits of healthcare you work in. And some of the developments, certainly in healthcare, around robotics, around artificial intelligence, I think are going to be hugely important. And going back to climate change, I think that there's a huge role as well for technology to make a difference. I think we need to make a difference ourselves by our behaviour and our consumption. But I think also things like the technological removal of plastics, and some of the research answers to some of the problems we're facing are really key as well. So I don't think that climate change can be dealt with through a technical fix, though. I think I absolutely agree about it being an issue of us changing our consumption, and that focus. But I think also that we need to do excellent research on it. So I would really encourage people who are watching to consider public health, and we really would welcome the sort of skills and expertise that people would have, and also the forward-looking nature that comes with a sort of new generation of people who would come through and change what we're doing and improve it.
Thank you so much, Garth, for answering that question, and also thank you for taking the time today to speak with us and for participating in this expert session. It's been great. I've learned so much, and it's really great to get your insight and your advice on all of this. I'd also like to thank anyone for submitting their questions. I'm sorry if we didn't answer them all, but we tried to fit as many as we could. So if you're interested in a career in the healthcare sector and want to find out a little bit more, you can head over to www.myworldofwork.co.uk, where you can find out more about careers such as the ones you'll see on the screen here. There are lots of excellent tools on our website, from identifying your strengths and your skills to exploring job profiles with things like wages and job descriptions and what you need to get into those roles qualification wise. You can also speak to your career school advisor, and they will provide you with any information and guidance. If you're interested in an apprenticeship, you can head over to www.apprenticeships.scot, where you will find information on all apprenticeships, whether that's modern, foundation or graduate. There are currently several modern apprenticeships available with the NHS, from theatres and anaesthetics to mental health services and healthcare support. So if you're interested in that, please go over and check it out. I'd like to remind you that this session has been recorded and will be available on our YouTube channel, so feel free to go back and watch anytime. So thank you for joining us today, and thank you to Garth, and I hope you all have a good day. Thank you.